Today's video is about play, the value of play, and the value of play in hospitals and in clinical settings. What's that got to do with economics? What's that got to do with inclusion? What's that got to do with accessibility? Well, I came across a thread on X, and it was about health play specialists, and they were doing a presentation at a conference, and it took me back. So, what are health play specialists? I might get this wrong. Correct me if I get it wrong, but basically, health play specialists are and they have different terms globally. They're people who, or more to the point, professionals who understand the use of play in the context of the clinical setting. That's my understanding of it. I could be out of date. And I'm thinking more back to when my daughter was going through her cancer treatment. Now, here's the thing, and I've always I did did some research about this a few years ago academically, but critically, the term play is misunderstood, and I love health play specialists. I think they're absolutely amazing, and I think actually um, their job is misunderstood by the general public. I think their jobs also are actually misunderstood by clinicians as well as a whole, because it's the word play. Well, actually, it's not play. People don't. When you think about I want you to think just for a moment about you playing a game when you were a child, when you play games with friends, when you play computer games or anything else. What are you really doing? Seriously, what are you really doing? If you're if you're playing a game on your own, basically you're developing your cognitive ability, or or you're certainly you're firing up your brain and you're getting it working. If you're playing with others, computer game, word games, football, tennis, anything, any game that's involved one other person yourself, you're actually socially interacting. Then you're also communicating. Now that could be communicating visually, auditory, through touch, numerous different mediums and modes. But either way, you are communicating just like I am at the moment. Speech, tone, my hand movement. So in the in the in the activity of play, when you're actually playing, there are lots of things that are going on. Now, how do health play specialists actually help in the clinical setting, and where is the economic value? Well, the bottom line is that actually the health play specialists can help kids relax. They can take their mind off of things. They can distract. Critically, they can assess the functionality of that individual and how they're performing, stress levels, fine motor skills, gross motor skills. They can assess all of that and actually feed that back to the clinical team. And what that does is that helps them build up that bigger picture of what's going on with a child. Now, the reason why I love them absolutely so much from the bottom of my heart is because they carry their worth. Their job, how much they get paid, far exceeds their economic worth to the organization. And I argue, and I have argued for the case, that they're completely and utterly underpaid. And I'm going to give you a story. Many years ago, my daughter had a brain tumor and she was going in for chemo and radio. And on a very regular basis, too regular, unfortunately, she was having to have MRI scans. Um, and I witnessed this again, time and again, when we were going in for treatment. We saw kids going in for MRI scans time and time again. And ultimately, you need the person to relax in order to get them in a position where they don't move around when they go into the MRI machine, so the scan can take place. That's the bottom line. You need to get that person in that machine, not basically still, so the pictures can take place. If you've ever had an MRI done, noisy, sensory overload, really quite is actually quite frightening, or it can be quite frightening, particularly the noise and the bang, 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 and then that overall experience, horrible. Here's the thing: you've got a kid that comes in who's got to go in for an MRI scan. One of two ways of getting them still either completely get them relaxed or sedate them. Now, what's most cost effective? If you're in the States and watching this, well, actually, I believe you're in a more or less for-profit based health organization. So costs count at the end of the day. And if the organization doesn't have to pay, or it depends which where you're coming from, but basically, if it's the insurers that's paying out, then actually they might not have to, like they're gonna have to pay for the MRI scan, the bottom line. Now, here's the thing: that child has got to go in for the MRI scan, and it's going to take a period of time. So if they've got to, if they're very, very stressed, potentially, and they can't sit still, what they've got to do is they've got to be sedated. Now that takes a team, but also the person's got to go in earlier in the procedure. They've got to have the needles put into them. Then they've got to be sedated. Then they go into the machine itself. They have the procedure, which is because they're being sedated. You need I believe a person, anaesthetist around as well to make sure everything's okay. So the number of staff actually exponentially increases because the person's under general anesthetic, which means the costs increase. And there's a risk factor as well because if somebody's sedated. So, um, I don't mean just, but to get that particular picture. But here's the role of the health play specialist. And I've seen it time and time again. You've got health play specialists, or whatever label you want to call them, whatever label they have globally, where these people are skilled in play, but critically, they're skilled in interactions, observing. And I've seen numerous health play specialists who are phenomenally skilled at what they do, and they build a rapport with the child. They then relax the child, and ultimately, the child doesn't actually need to have a general anesthetic when they go in for an MRI scan, which means you're actually eliminating quite a few professionals in that journey. And ultimately, what you're doing is you're reducing the cost to the hospital, to the insurance company. And the health play specialists, ultimately what they're doing is they're reading, they're observing, they're relaxing, they're taking the person through. And if you look at their salary, which I think it's a crying shame that they're paid, they're not paid as much as they should be. They offer true value for money. And it comes down to, again, play. And I know that I'm repeating myself, but basically, the health play specialists are phenomenally skilled in observation, relax, and basically they can relax the child. They can use play to engage the child to get them into a mental state where they can get into the MRI machine. Now, that's just the MRI machine. And that's, I would say, an extreme example of a costly procedure. But then you've got the day-to-day procedures of when you've got the kids coming in who might have to see a doctor, and the kids have got to have their a blood test and let's say what's that thing called, blood pressure test, and they've got to be essentially viewed by they've got to be observed by clinicians. The role of a play specialist, again, is critical because what they do is they can enable and support effectively that pathway for those children to go in, be seen, and come out. So where does it come down to the whole theme of the we can access and the economics behind it? Well, actually, I would argue, and I've argued for years, that actually health play specialists are absolutely economically worth all hospitals having, wherever you've got children, because ultimately you can potentially offset the cost of their salary compared to the value that they are bringing, the reduction in stress, the number of children that can be seen. Ultimately, what they're doing is they're improving the economic efficiency of that organization to see the patients, and they're reducing the harm. And then thinking in the long term, what they're doing is they're potentially reducing the trauma to the child and the parents. So overall, if you work in any form of healthcare setting, and it involves children, I strongly advise you to look at what health play specialists do, or play special or yeah, health play specialists do, and they have different titles globally. And I strongly advise you to look into what they do, the value that they bring, and how they enhance the clinical pathway for children, with basically for all children, particularly for those who have hidden and visible disabilities, because ultimately it improves overall the system. And if you've got an amazing one, they're just ultimately they're gold dust. They are phenomenal, and I've seen some phenomenal health play specialists in the journey. Play is not play. Play ultimately is observation, identification, um, seeing skills development. Thank you very much for the time. And again, sorry for rambling. I'm new to this stuff, so I'm getting there. Take care. Oh, sorry. Any questions? Drop me a line. And I'm going to put a link to the UK Health Play Specialist organisation. Can't quite remember what they're called. I think they recently changed their name and merged, but really look into them. Take care. Bye.